There are two types of health insurance coverage available for refugee claimants during the claim process. The Interim Federal Health Program and the BC Medical Services Plan are the two health insurance programs that cover the cost of health services for refugee claimants living in BC. IFH covers a refugee claimant from the moment they receive their Acknowledgement of Claim document until they receive a positive notice of decision on their refugee claim. If the decision is negative, the health coverage through the IFH continues during the appeal process. If a claimant is found to be a protected person, their IFH coverage is terminated within 45 days. They must apply for MSP coverage if they are not already enrolled with MSP. All refugee claimants are eligible for MSP coverage as soon as they are issued a work permit. Even though all claimants have IFH coverage, it is highly suggested they enroll in MSP as soon as they are eligible. This video will discuss each coverage plan in detail. What is the Interim Federal Health Program? The Interim Federal Health Program is a temporary health insurance that covers certain healthcare services for refugee claimants. Once a person makes a refugee claim and provides IRCC with all the necessary paperwork, IRCC will either issue an Acknowledgement of Claim document or a Refugee Protection Claimant document for each family member making a claim. Both of these documents state that the claimant has health coverage under IFH. The documents must be presented at the time of receiving medical services as proof of coverage. If a claimant does not present either of these documents at the time of their medical visit, they might be asked to pay for services out of pocket. IFH pays directly to the medical service provider. It does not reimburse claimants if they paid out of pocket for medical services. For this reason, it is very important to present either the Acknowledgement of Claim document or the Refugee Protection Claimant document at the time of receiving services. What does it cover? Basic coverage is similar to healthcare coverage from provincial or territorial health insurance plans. Basic coverage includes inpatient and outpatient hospital services, services from medical doctors, registered nurses, and other healthcare professionals licensed in Canada, including pre- and post-natal care, laboratory, diagnostic, and ambulance services. Supplemental coverage is similar to the coverage given to the recipients of social assistance by the provincial and territorial governments. Supplemental coverage includes limited vision and urgent dental care, home care and long-term care, services from allied healthcare practitioners, including clinical psychologists, psychotherapists, counseling therapists, occupational therapists, speech-language therapists, and physiotherapists, assistive devices, medical supplies, and equipment, including orthopedic and prosthetic equipment, mobility aids, hearing aids, diabetic supplies, incontinence supplies, and oxygen equipment. Prescription drug coverage is similar to the coverage provinces and territories give to social assistance recipients. This includes prescription medications and other products listed on provincial and territorial public drug plan formularies. You don't have to accept services from healthcare providers who don't take part in the IFHP. For example, if a pharmacy asks you to pay for medication, you can find another pharmacy that is registered with the IFHP. Please note that some of the larger pharmacy chains are not registered with IFH. It is better to find a smaller pharmacy and check if they are registered with IFH to obtain prescription drug coverage. You can do this by presenting your Refugee Protection Claimant document or Acknowledgement of Claim document. Coverage for the immigration medical exam. For most beneficiaries, IFH also covers the cost of one IME and IME-related diagnostic tests required under the Immigration Refugee Protection Act. IFH does not coordinate benefits with other insurance plans or programs, so co-payments are not possible. The benefits covered by the IFH program have certain limits, including maximum dollar amounts. For more details on maximum amounts of coverage, consult their website by searching for IFHP coverage on your web browser, clicking on the first link, and scrolling down to the bottom of the page. Even though IFH provides basic coverage for doctor visits, not all clinics are registered with IFH. You must call ahead of time and confirm that a clinic or medical service provider accepts IFH insurance. SOS has created a list of IFH registered clinics in the Lower Mainland. Contact your settlement worker to obtain this list. Length of coverage. Basic supplemental and prescription drug coverage continues until the beneficiary leaves Canada or becomes eligible for provincial or territorial health insurance. Individuals who have made a refugee claim and are waiting for an eligibility decision are also covered by IFH. Refugee claimants continue to be eligible for the IFH program after their refugee claim is rejected. Ineligible claimants that are or will be eligible for a pre-removal risk assessment (PRRA) are also covered by IFH. Start date. The interim federal health program coverage starts on the date a person's eligibility document is issued. This is the Acknowledgement of Claim document or the Refugee Protection Claimant document. An IRCC or CBSA agent will issue these documents. End date. If you made a refugee claim from within Canada, you are eligible for coverage until you withdraw your refugee claim or the Immigration and Refugee Board of Canada, IRB, finds you abandoned your refugee claim, or your refugee claim isn't eligible and you can't apply for a pre-removal risk assessment, PRRA, or you leave Canada. Your IFHP coverage will automatically expire 45 days after the decision date if the IRB finds you to be a convention refugee or you get a positive decision on your pre-removal risk assessment application. IFH program coverage will be canceled immediately if the refugee claimant withdraws their claim for refugee protection, the IRB determines that a claim for refugee protection has been abandoned, the claim for refugee protection is ineligible to be referred to the IRB, and the refugee claimant isn't eligible to apply for a PRRA. MSP. In Canada, each province and territory has its own medical insurance plan. The Medical Services Plan, MSP, is the provincial insurance program that pays for required medical services in BC. As of January 2020, MSP is free of charge for most BC residents. You must still enroll in the program and have a valid MSP card in order to receive free healthcare services. Unlike IFH, all primary healthcare clinics in BC are registered with MSP, making it far more convenient to receive free medical services if you are enrolled in the MSP program. You can apply to enroll with MSP online or by mail. Who is eligible for MSP? Refugee claimants and their dependent children who reside in BC are eligible to enroll in MSP once they receive a work or study permit that is issued for at least 6 months. Children of claimants who are under 18 years of age or are enrolled in full-time studies must be under a parent's MSP account. Once a child turns 18 and is not enrolled in full-time studies, they must apply for their own account. Protected persons and convention refugees are also eligible for MSP. Since IFH coverage ends 45 days from the date of the Notice of Decision letter issue date, it is very important to apply for MSP immediately after receiving the Notice of Decision if not already enrolled. Every time a new work permit is received, the claimant must re-enroll in MSP by providing a copy of the new work permits online or by mail. If a claimant becomes a protected person, you can apply online or by mail using a copy of your positive notice of decision. If a protected person is already enrolled in MSP when they receive their notice of decision, they should update MSP with their new immigration status. This way, new cards will be issued with an expiration date of 5 years, and it will no longer depend on the work permit expiration date. What does MSP cover? MSP provides the following benefits: medically required services provided by a physician enrolled with MSP, maternity care provided by a physician or midwife, medically required eye examinations provided by an ophthalmologist or an optometrist for adults aged 19 to 64, annual eye examinations for children up to 18 years of age and seniors aged 65 or older, diagnostic services including x-rays provided at approved diagnostic facilities when ordered by a registered physician, midwife, podiatrist, dental surgeon, or oral surgeon. Dental and oral surgery when medically required to be performed in hospital, excluding restorative services such as fillings, caps, crowns, and root canals. Orthodontic services related to severe congenital facial abnormalities. The removal of healthy wisdom teeth, even if impacted, is not a benefit. Surgical removal of an impacted third molar, such as a wisdom tooth, is an MSP-insured service only when hospitalization is medically required. Supplemental coverage. Only protected persons and convention refugees are eligible for supplementary coverage and must apply for it using the Notice of Decision. Eligibility is also dependent on family income and is decided by using the tax return information from 2 years prior. Length of coverage. MSP coverage depends on the expiration date of the work permit or study permit used to apply. MSP coverage usually ends on the same month as your work permit expiration date. For this reason, it is very important to renew your work permit at least 3 to 4 months before the expiration date. IRCC usually takes between 2 to 3 months to renew a work permit. Once you receive your new work permit, you must reapply for MSP online or by email. Please note that it usually takes 21 days from the date MSP receives an application to process and for coverage to be activated. New cards with a new expiration date will be issued each time. The new card will reflect the same expiration date as the new work permit. If you have any questions about how to apply for MSP or how to update your status once you become a protected person, please contact your settlement worker.